Hello and welcome. And if you're new here, I'm Dr. Baza Khalid. I'm an internal medicine and obesity medicine specialist. And today, let's talk about a question that's on a lot of people's mind: Wegovy versus Zepbound. Which one is better for weight loss? These two medications, Zepbound and Wegovy, are making huge waves in the world of weight management, and for good reason. They are incredibly effective, but they're not exactly the same. In this video, I'll break down everything you need to know: what are Wegovy and Zepbound, their unique mechanisms of action, who they are indicated for, potential side effects, important safety warnings, what are the clinical trials actually showing in terms of weight loss, cost considerations, and ultimately how you and your doctor can decide which one might be the best fit for you. So, what are Wegovy and Zepbound? Let's start with the basics. What exactly are these two medications? Wegovy, this is the brand name for semaglutide approved specifically for chronic weight management. It's an injectable medication typically taken once a week. Mechanism of action of Wegovy is that it is a glucagon-like peptide 1, commonly known as GLP-1 receptor agonist. This means it mimics a natural hormone in your body called glucagon-like peptide 1. Indications for Wegovy are that it is FDA approved for adults with obesity with BMI of 30 or more, or overweight with BMI of 27 or more, with at least one weight-related condition such as high blood pressure, type 2 diabetes, or high cholesterol. Let's talk about Zepbound. This is the brand name for Tirzepatide, also approved specifically for chronic weight management. Like Wegovy, it's an injectable medication typically taken once a week. Mechanism of action of Zepbound is that it is a dual agonist, meaning it mimics two natural hormones, GLP-1 and GIP, which is glucose-dependent insulinotropic polypeptide. The addition of GIP is a key difference between these two medications. Zepbound indications are that it is FDA approved for adults with obesity with BMI of 30 or more, or overweight with BMI of 27 or more, with at least one weight-related condition. Are you already on Wegovy or Zepbound, or just starting research? Let me know in the comments if you have heard about these medications or if one of this is new for you. Both GLP-1 and GLP-1 GIP medications work by activating the GLP-1 receptor, which helps with: number one, slowing gastric emptying. Food stays in your stomach longer, making you feel fuller for longer. Number two, appetite suppression. They signal to your brain that you're full, reducing cravings and overall food intake. Number three, blood sugar regulation. They stimulate insulin release when blood sugar is high and reduce glucagon secretion, which help with lowering blood sugar. But here's how Zepbound or Tirzepatide takes it a step further. It also activates the GIP receptor. GIP is another natural hormone in your body that, when activated by Tirzepatide or Zepbound, appears to offer additional benefits. It might further enhance the feeling of fullness and reduces appetite. It seems to have a direct effect on fat tissue, potentially promoting fat loss more effectively. And the combination of both GLP-1 and GIP appears to lead to greater improvement in insulin sensitivity and blood sugar control. So, what are common and serious side effects of these medications? While effective, it's crucial to be aware of the potential side effects of these medications. Both medications share very similar side effect profile because they both activate the GLP-1 receptor. Common side effects are usually mild and transient, especially when starting or increasing the dose of these medications. Gastrointestinal side effects are the most common, like nausea, vomiting, diarrhea, constipation, abdominal pain, or bloating. These are the most frequent. Other side effects could be heartburn or acid reflux, fatigue. How about strategies to manage these common side effects? Start at the lowest dose and titrate up slowly as your doctor instructs. Eat smaller, blender meals. Stay well hydrated and avoid fatty, greasy, or very sugary foods. Let's talk about serious side effects. These are rare but important to be aware of and warrant immediate medical attention if experienced. These are pancreatitis or pancreatic inflammation. This usually causes severe abdominal pain, often radiating to the back with nausea and vomiting. Gallbladder problems. These usually cause severe abdominal pain, nausea, vomiting, and sometimes fever. Rapid weight loss can sometimes trigger gallbladder issues. Kidney problems can worsen pre-existing kidney issues or cause new ones, especially with dehydration from GI side effects. Hypoglycemia or low blood sugar, especially if you are also taking other diabetic medications like insulin or sulfonylureas. And allergic reactions causing swelling of the face, lips, tongue, or throat, difficulty breathing. Let me ask you a question here. If you are on Wegovy or Zepbound, what has been your most challenging side effect and how did you manage it? Share your tips in the comments below. Let's talk about FDA black box warning. Both Wegovy and Zepbound carry an FDA black box warning. This is the strongest warning the FDA puts out on a medication, and it's there to highlight serious, potentially life-threatening risks. For both medications, the black box warning is regarding the risk for thyroid C-cell tumor, including medullary thyroid cancer. Why this warning? It's based on studies in rodents where these medications cause thyroid C-cell tumors. However, important caveat is that it is unknown if these medications cause thyroid C-cell tumors, including medullary thyroid cancer in humans. So far, human clinical trials have not shown an increased risk. So, who should not use these medications? If you have a personal or family history of medullary thyroid cancer or multiple endocrine neoplasia syndrome 2, you should not take Wegovy or Zepbound. This is why your doctor will always ask you about your personal and family medical history before prescribing these medications to you. It's a very rare condition, but it's a critical safety point. Let's look at the clinical trials. Zepbound and Wegovy efficacy head-to-head. Now for the exciting part for many of you. What do the clinical trials say about weight loss efficacy of these medications? And this is where Zepbound truly shines. Wegovy or Semaglutide, in the pivotal clinical step 1 trial, participants without diabetes lost an average of 15% of their body weight over 68 weeks. This was significantly more than placebo, around 2.4%. This was a groundbreaking amount of weight loss for a medication and truly changed the landscape of obesity treatment. Zepbound or Tirzepatide, in its pivotal clinical trial SURMOUNT-1, participants without diabetes achieved more dramatic results. At the highest dose of 15 milligram, participants lost an average of 21% to 22.5% of their body weight over 72 weeks. A significant percentage of participants, over 50% at the highest dose, achieved a 20% or greater weight loss, which is closer to the results seen by bariatric surgery. So head-to-head conclusions from these trials are purely based on average weight loss observed in clinical trials. Zepbound Tirzepatide appears to offer greater weight loss efficacy than Wegovy or Semaglutide. The addition of the GIP component seems to be a significant factor here. However, it's crucial to remember that these are averages. Individual results will vary greatly. Some people may respond better to one medication over the other one. And the best medication is the one that works for you with manageable side effects. How about cost considerations for these medications? Let's talk about the elephant in the room for many people, cost. Both Wegovy and Zepbound are brand name medications and their cash price without insurance is substantial. Cash price without insurance both typically cost around $1,000 to $1,300 per month in the US. This is the retail price. However, the insurance coverage is the biggest variable. Coverage depends entirely on your specific insurance plan. Many plans still do not cover weight loss medications, or they require strict criteria like prior authorizations, trying other medication options first. Manufacturer coupons or saving programs are a good option. Both manufacturers like Novo Nordisk for Wegovy and Eli Lilly for Zepbound offer manufacturer discounts with starting dose of Wegovy injection around $199 and starting dose of Zepbound at $299. Cost does go up for higher doses. Always check the manufacturer website for current program options and discounts. Now, Wegovy pill was recently FDA approved and is offered at starting price of $149. I have a detailed video on Wegovy pill that I posted a few weeks back if you're interested to hear more about this oral option. So the million-dollar question still is, which is better for weight loss, Wegovy or Zepbound? Based on clinical trial data, Zepbound or Tirzepatide generally leads to a greater average percentage weight loss compared to Wegovy or Semaglutide. However, better is subjective and depends on you and several factors like individual response. Your body might respond better to one medication over the other or tolerate one side effects versus the other. Side effect profile. Some people find one causes fewer GI side effects than the other medication. Insurance coverage and cost. The medications you can afford and get covered is the better one for you if it works. Overall health goals. While both are for weight loss, if you're also type 2 diabetic, the comprehensive metabolic benefit of both of these medications are excellent. How about some do's and don'ts for both medications? Do's are: do work with a qualified healthcare professional experienced in obesity medications. Do follow your doctor's dosing instructions precisely. Do report all side effects to your doctor, even the mild ones. Do maintain a healthy lifestyle with balanced nutrition and regular physical activity. These medications are tools, not replacement for healthy habits. Do store the pens correctly based on manufacturer recommendations. Don'ts are: don't share your medication pens or reuse needles. Don't stop the medication abruptly without consulting your doctor. Don't ignore serious side effects like severe abdominal pain, persistent vomiting, or signs of an allergic reaction or dehydration. And don't self-prescribe or buy from unregulated resources. This is extremely dangerous. Let's quickly debunk a few myths and arm you with questions to ask your doctor. Myth is, these are quick fixes, I'll just lose weight without trying. Fact is, while effective, these medications work best when combined with dietary and lifestyle changes. They help you stick to those changes by reducing hunger and cravings. Another myth is you'll regain all the weight the moment you stop these medications. Fact is, this is partially true. Without continued treatment or a sustainable maintenance plan, weight regain is very common, just like after most weight loss interventions. This is why obesity is considered a chronic disease requiring ongoing management. Another myth is they're only for people with diabetes. Fact is, both Wegovy and Zepbound are specifically FDA approved for chronic weight management in people without diabetes. Their counterparts like Ozempic and Mounjaro are for diabetics. How about some questions to ask your doctor? Based on my health history and goals, which medication do you think is a better starting point for me? What are the most common side effects I should expect and how I can manage those side effects? How will we monitor progress and any potential side effects? What are the long-term plans for managing my weight if I start one of these medications? What are my insurance coverage options and potential out-of-pocket cost? There you have it, a comprehensive breakdown of Wegovy versus Zepbound. Both are revolutionary medications for weight loss, but Zepbound, with its dual GLP-1 GIP action, shows slightly higher efficacy in clinical trials. The better one, however, is truly a personalized choice you'll make with your doctor, considering efficacy, side effects, and of course, accessibility and cost of these medications. Remember, achieving a healthy weight is a journey, not a destination. These medications are powerful tools that can significantly help, but they are a part of a larger plan for your overall metabolic health. If this video helped you understand the differences, please hit that like button, share it with someone who needs this information, and subscribe for more evidence-based weight loss advice directly from a weight loss doctor. Stay healthy, stay informed, and I'll see you in the next one. Bye for now.